Okay, so we're going to start with palpations. So I'm going to start at the inferior patella. Can you make sure you can see? Okay. And then the patellar tendon and the tibial tubercle. And then go medial. And that's the joint line, that little divot here. MCL. Is that tender? Mm-hmm. MCL goes from the medial epicondyle down to the medial tibial plateau. And then you can go in the joint line lateral and keep going more lateral, and you'll feel the LCL. And that goes from the lateral epicondyle down to the fibular head right here. And then what's the other one? Just the IT band, which is more proximal to the lateral epicondyle. Okay, so we'll do the varus and the valgus test. So leg or knee at 0, and put one hand here, one in here, relax your leg. Okay. That's at 0, 30 degrees. Okay. Now let's switch my hand placement for the varus. 0, 30 degrees. And then Lockman's test is at, what is this one? Oh, knees bent here. And then, so one hand goes here, then the other hand is here, and you're just pushing down. Yeah. Okay, like that. The anterior drawer. Knees at 90. Sit on the foot. Can you see what I'm doing? Mm-hmm. Okay. And then this one, your thumbs are around the front, and your fingers wrap around the back, and you're pulling, doing an anterior tibial translation. A pivot shift, knees at 90. Oh, it's this one, where you medially rotate, then you extend to see if you hear or feel a thud. Let me see on my list. Just did that. Okay. Posterior sag test. Hip and knees at 90. Can you relax? And then just hold it here, and you're looking to see if the tibia is sagging posterior to the epicondyles. The posterior drawer test. Same thing. You sit on the knee, or sit on the foot. Knees at 90, and this time you're doing a posterior translation. I'm not in a good position, but you get the idea. Goes that way. Same direction as the joint line. The McMurrays. I don't like this one. This one, you're going out and in. Then you can do internal rotation while you come up. And then you can do different variations of that external rotation. So you can add some varus forces while you're doing it. Whatever. I'm not going to do the Thessaly thing. That's the standing one. The applique compression is where you're actually on your stomach. I'll see if I can. Yeah, that should be good. Hopefully you can see. So one leg bent. I'm going to use my knee so I can get a good grip. You pull up, you twist. And the other one is pushing down and twisting. Okay, you can flip back over. I hope you got that.
I didn't move.
Okay. It's a nice little thing on my couch, by the way. Where is I at? Oh, okay. patella compression test. So knee is at 30. Oh yeah. 30, my knee. You relax. And then you're pushing. You can do it at 0 too, which I'm going to do because yours isn't very movable. There we go. You push the patella lateral. And then the Clark's test is knee bent a little bit. Oh no, it's straight. I lied to you. And then you push above the patella a little bit and push down. And then contract your quad and relax. And they wouldn't want to do it. The test was positive. It'd be painful. And then the patellar tilt test I'm not doing. The ballottement for edema. I don't know how to pronounce that, but it's for edema. Push them together, and then you tap to feel if the patella is like floating or whatever. And then the Noble compression test. Put my hand on the IT band here. Do some, bend your knee. Do some flexion extension. And that would be painful. All right, and that's it.